In this video, we'll be taking a look at the condition of prediabetes in African Americans between the ages of 20 to 40 years old. What is prediabetes? Why does it disproportionately affect African Americans? How do you know if you are at risk for prediabetes? What can be done to prevent or treat this condition? These are some of the questions that will be answered in this video. Prediabetes, formerly called borderline diabetes, is a condition in which your blood sugar, or blood glucose, is between 100 to 125 milligrams per milliliter during fasting. A normal blood glucose level is between 70 and 100 milligrams per milliliter during fasting. 1/3 of American adults are in the pre-diabetic range. 90% of people affected by prediabetes will go undiagnosed due to not being tested. African Americans are 1.6 times more likely to develop diabetes. Prediabetes affects approximately 86 million Americans. 4.9 million of those affected by prediabetes are of African American descent. One major factor is the lack of available fresh produce. In low-income neighborhoods with a high African American population, grocery stores are replaced by convenience stores. This phenomenon, known as an urban desert, is one of the major factors prediabetes affects African Americans. There are some factors that might contribute to the likelihood that a person could be diagnosed as pre-diabetic. Those risk factors are: family has a history of diabetes, gestational diabetes in pregnant women, a high BMI or body mass index, not enough physical exercise, dark, thick patches of skin around the neck and armpits, having been diagnosed with polycystic ovary syndrome in African American women. Some of these factors are beyond a person's control, but others are important lifestyle choices for avoiding prediabetes. Research has shown a very strong link between gestational diabetes and developing prediabetes. A woman is 35 to 60% more likely to be pre-diabetic within the next 10 to 20 years if she's had gestational diabetes. Although a lot of people with prediabetes can be asymptomatic, there are some symptoms that may present themselves. These include increased levels of sugars in the blood and urine, frequent urination, starvation, constant thirst, weight loss, weakness, extreme fatigue, mood swings, nausea, vomiting, irritability, skin infections, blurred vision, and prickly dry skin. If you experience any of these symptoms, you should contact your doctor and tell them about them. Acanthosis nigricans is a skin condition characterized by areas of dark velvety discoloration in body folds and creases. Acanthosis nigricans is a sign of prediabetes and should be brought to the attention of your doctor. A major risk factor in the development of prediabetes is a poor diet. A diet high in added sugar, sodium, and fat is a major cause of prediabetes. Traditional African American foods can be high in these nutritional categories. Learning to prepare traditional foods in a healthy manner is an important step to help prevent prediabetes among African Americans. Putting a healthy twist on traditional foods can reduce fat, sugar, and sodium to a diet. Knowing the correct portion size for each individual food group is also a key component to a diet that can lower the risk of prediabetes. The hand jive method, developed by the Hibnini nutrition consultants, is a quick and easy way to measure sensible portion sizes. Using this technique, you can decipher the correct portion sizes without having to use scales. An overall healthy diet is the key to the prevention of prediabetes. A great source to see if your diet is a healthy one is the government website choosemyplate.gov. This website will give you the correct serving of each food group needed for your body type, as well as let you know the correct amount of vitamins or minerals needed in your diet. Using these guidelines in conjunction with exercise, you can lose weight and dramatically lower your risk for prediabetes. Exercise is another key factor in preventing prediabetes. It is recommended that people should get at least 30 minutes of exercise 5 days a week. Everyone thinks they don't have time to exercise. But if you are not a fan of exercise, start small, like taking a brisk 15-minute walk. Little things like this can add up and boost your activity level. The treatment for prediabetes is simple to say, but can be difficult for people who have fallen into unhealthy habits. What needs to be done? Eat a healthy, balanced diet, trying to minimize processed foods and added sugar. Routinely exercise. Take small steps to increase your activity level. Follow these steps and you can prevent your prediabetes from developing into type 2 diabetes. There are a few tests your physician can order if they suspect you are pre-diabetic. They are fasting plasma glucose test, oral glucose tolerance test, or hemoglobin A1C test. The fasting plasma glucose test measures your blood sugar level after 8 hours of fasting. The oral glucose tolerance test records your blood sugar after fasting, and then after 2 hours you drink a sweet drink and the levels are tested again. In the A1C test, the test looks at your average blood sugar levels over the past 2 to 3 months. Ask your doctor if he thinks one of these tests may be necessary. Knowing if you are at risk for developing prediabetes is the first step in prevention. The Center for Disease Control has a quick test to check to see if you are at risk. The test will take you through, step by step, the risk factors for prediabetes. Diet is a major cause of hypertension as well as prediabetes. Although age is a factor, it is never too late to start healthy habits. Increasing your activity level, even in small increments, aids in prediabetes prevention. Although gestational diabetes typically resolves itself after pregnancy, those diagnosed are at a much higher risk for prediabetes. Since men are less likely to visit a physician, they are at greater risk for going undiagnosed. So guys, go see your doctor and know the risk factors for prediabetes. Being overweight is a risk factor in developing prediabetes. Knowing your BMI is an important tool in understanding what a healthy weight should be for your body type. Here is the CDC website where you can take your free test today. Knowing if you are at risk for prediabetes is the first step in prevention and a path to a long and healthy life. Thank you for taking the time to watch our video.